Greetings, I'm Annalisa Jack, a medical scientist by profession, and I currently practice evidence-based medicine. Welcome to Medical Insight, Unlocking Medical Research. There's vast knowledge from medical research that often circulates amongst medical researchers, and so this platform is meant to bridge the gap between medical researchers and the public. This is a platform to engage about healthcare issues. And today's topic is on the impact of funerals, culture, and religion on COVID-19. I've decided to talk about this topic, COVID-19, because one of the basic measures required to control the infection is behavioral change, meaning changing behavior. I understand how difficult changing behavior can be, and I also understand that some of these measures have been lifted in South Africa and in some other countries as well. But I implore you to continue practicing measures such as physical distancing, washing your hands with soap and water for 20 seconds, and coughing and sneezing onto a flexed elbow. This topic was inspired by a research paper entitled Social Distancing: How Religion, Culture, and Burial Ceremony Undermine the Effort to Curb COVID-19 in South Africa. The World Health Organization declared COVID-19 a pandemic, and when this pandemic hit South Africa, our government eventually declared it as a national state of disaster.
We have now declared a national state of disaster.
However, even so, South Africans had other plans, not taking this seriously. I do not think we understand how serious coronavirus is. This new coronavirus causes a respiratory illness called COVID-19, which can be fatal. COVID-19 presents with mild to severe symptoms. Mild symptoms include coughing, sneezing, and a sore throat. And severe symptoms are breathing difficulties, which can eventually cause death. Amid this pandemic, several countries decided to put measures in place to try and control the spread of this infection. For instance, South Africa decided to halt religious activities, it decided to halt cultural activities, and also limit funeral attendance to 50 people. The reason behind putting these measures in place was not to punish anyone, but it was to make sure that the spread of COVID-19 is controlled. For an example, we all know that it would be difficult to maintain physical distancing at church. The same thing applies when it comes to other cultures which pose a very high risk of infection. And the very same thing applies when it comes to funerals with a multitude of people.
My God, it's got the voice of an angel. It's breathtaking.
Other measures that I would love to mention that were not mentioned in the paper I cited earlier on include alcohol, cigarette, and travel bans. These were banned.
So when people saw, they put saliva on the paper.
People would be prevented from having a negative impact as a result of what I've just mentioned. So these have the potential to weaken the immune system. Hence, at some point, they were burned. So this is what it means by how religion, culture, and burial ceremony undermine the effort to curb COVID-19. Thank you so much for listening. I hope you'll tune in next time. Cheers.